Most parents naturally find it very challenging to talk to their child about having cancer. Or maybe you feel the same way, and you're asking yourselves maybe, how do I best start talking about this? What should I say? And how much? Or you might be wondering, is it even a good idea to talk to my child about it at all? I'd like to explore these questions together with you now. And one thing up front, it's absolutely clear that, as a loving mother or caring father, you would always do absolutely anything and everything possible to protect your child. But in practice, in the real world, that is not always possible, is it? So if you are still debating back and forth about whether you should really tell your child what's going on, then the recommendation is a very clear, yes, you should. Absolutely. Because in the end, it always helps to be honest. That is because children have especially sensitive antennae for when something isn't right. And if they don't receive an explanation, they'll just make something up themselves. And those can be the wildest stories. And in the worst case, that can sometimes result in even more fear than calling things by their name and dealing with them. So, try to be as open and honest as possible with your child. Because if you are honest, your child will then also feel much more encouraged to talk to you openly about their worries and fears and to ask questions, and importantly, the same goes for their siblings, of course. The better they are able to fully understand and process what's happening with their sick brother or sister, the better they can truly comprehend their own situation and effectively deal with their own worries, concerns, and fears. Okay, so far so good, right? But what's actually the best way to have this talk now? So how exactly can you talk to your child about their cancer disease? Well, of course, there's unfortunately no fixed script for this, that you can just memorize and then rattle off. Every child and every family is different. So the talk can go very differently. But what you can generally say is that the child's age, of course, plays a very important and significant role. That means you should adapt your explanation to your child's particular developmental stage and level of understanding. What that means, or what it can mean in different situations, we'll go through together now. So if your child is only about 2 or 3 years old, then of course they can't really understand what an illness or even a cancer disease is. At this age, it's still very much about very practical things, such as feeling, seeing, and directly experiencing the world around them. But you can still be very supportive and give security by naming or describing what's happening. Without going into too much detail in your explanation, you can, for instance, use picture books for this, or you can frame it playfully, for example, through role-playing. For example, the favorite doll or stuffed animal becomes the patient and maybe needs an IV or a bandage change, and you do that together with your child. And of course, afterwards, the doll is held and comforted. If your child is a bit older, say kindergarten or preschool age, they can already understand some processes and connections. Yes, and they'll probably also ask, why? Sometimes, children at this age also develop feelings of guilt. Yes, for example, because they believe they're sick now, because they argued with their sister or brother yesterday. That's why it's also important to make it clear to your child that no one at all is to blame or at fault for the illness. And of course, you should also explain that cancer definitely isn't contagious in any way. It's best to try to find vivid, memorable images or helpful comparisons so your child can better imagine and understand the illness and the therapy process. Something like, cancer cells are little troublemakers that cause mischief in the body and have to be caught again by the strong chemo nights. Something like that, Here too, there are great children's books that can help you explain, for example, from the Children's Cancer Foundation, and if your child is old enough to already be in school, then in addition to imaginative stories, you can also include pictures or models of the body. As a rule, children from about, 5 or 6 years old can already understand quite well how the body generally works, right? You can also find various videos on this page, especially for children of elementary school age, in which some of the basics are explained. And be prepared for the fact that your child will ask their questions in their own time. This can happen anywhere, and often at times when you least expect it. For example, when you're sitting in the car, or other daily situations like standing in line at the supermarket. When you then talk with your child about their cancer, it can of course also happen that they ask really tough questions, such if they have to die. As difficult as it is to deal with this question, it's important to remain honest here too. Then your child will feel that they can genuinely believe you and trust you. You can, of course, also turn to the psychosocial team for support. They have many helpful ideas and can work together with you to figure out which language, or which book, or which explanatory model is the most suitable fit for you and your family. Otherwise, remember that you do not have to tell your child absolutely everything right away. You can take your time and share information gradually as you feel is appropriate. First, it is best to pay attention to what they understand and what they even want to know. And if you don't have an answer to something, then just tell your child that. That is also important because it makes you authentic. And it is also recommended to encourage your child to ask their questions directly to the doctor themselves. Because when a child talks about their illness with the treating physician or nurses themselves, that can be really empowering. Try to have a little faith in your child in this regard. The most important thing is simply that your child truly feels deep down that you're always there, right by their side. And no matter what comes your way, you'll face it together.